Hello, I'm Creamy.
And I'm Ian, and we come from the Oceanside High School Health Careers Academy, and we will be your hosts. Today we'll be interviewing these beautiful young ladies that also come from the Oceanside High School Health Careers Academy that will be telling us about their global health project.
So can you introduce yourselves?
I'm Mariah.
I'm Abby.
And I'm Trinity.
So how did this start?
Doctors from Ohio State University came to us and they talked about their global health issues, and they're riding across America talking about all their global health issues, so this promoted us to talk about ours.
Riding where?
They're just riding to every
They're riding bicycles
yeah.
across the...
How many?
I think there's 15 of them.
Yeah.
And they're going to be stopping by schools just like ours to share with the students there.
So tell us about your project. What is your topic?
Our project is sex trafficking, which is a modern form of slavery in which victims are taken and they're forced to commit sexual acts against their will. It affects people all over the globe, no matter race, gender, age.
Why did you choose this topic?
Well, we chose this topic because it does affect everyone. It can affect people of any ages, but especially people who are our age, teenagers, and women.
And why else? Is there any personal link to why you chose this topic?
Nothing too personal, but just the fact that girls like me no longer have right to their own body.
So what are like statistics? Where does this affect the most?
It affects, not the most, but a majority comes from Asia, mostly Cambodia, and then here in the United States, San Diego alone has 8,000 to 11,000 girls trafficked each year.
Yeah.
So this isn't something you just see on TV. This is like happening.
Yeah, 80% of victims are female and 50% are children.
And weren't you shocked to find out all these statistics that we always thought it's just in all these Eastern countries?
Yeah. Because like you see on TV that it's in Asia or Africa. It's not in the United States, but it is. It's in North County, and that's scary.
How close is it?
It's happening even here in Oceanside, in San Diego, California, everywhere.
So, tell us how you made your project. What were the elements?
We made a brochure that explained all the symptoms, signs, ways to prevent, what is sex trafficking, and we also created a research paper that we had to do.
What was the purpose of your project?
It was to spread awareness of sex trafficking and to try to prevent it.
If there was something you could do, something else to help these women or anyone who is in this situation, what would you do?
Right now we have this idea of doing like a fun run or something, because that brings out a lot of people that could donate money towards campaigns that are already putting forth effort, and it would spread awareness.
Does this mainly affect women?
Yes.
But boys and transgender youth are even inducted into the industry.
Yeah.
What happens to these people in the industry?
They often get sexually transmitted diseases or mental health issues, so they'll get HIV, AIDS, they have PTSD, traumatic bonding with the trafficker.
So how do you end up in that position?
Most of the victims are runaways who are abused at home, and then there's like different techniques so that the traffickers use to get the girls.
Some of the techniques are the lover boy method, where they will create a relationship with the victim and then to earn their trust, and then they will force them into the industry. They'll also kidnap them and threaten people who are close to them.
Is there anyone who chooses to be in this industry?
No, not that we could find.
How bad is it? Like, what happens?
Well, victims are often beaten in areas that people won't see, so like their lower back, or just places that can be hidden by clothes. And also with the sexually transmitted diseases, they risk their life, and they will often get pregnant, and they'll be forced to have the child, and the child will be used as leverage, or they will be forced to go through an unsafe abortion, which can lead to other health issues and death.
And I also found they develop a lot of trust issues. One, I found a survivor story, and she described she was in a hotel with other girls, and 30 police officers came in, and she thought she was going to be liberated. She wasn't. They were there as customers, and they forced her and other girls into compromising positions and videotaped them and threatened that the public or their family would get those videos. And that to me is so disturbing, and that's one of the reasons that they can't get out of the industry, is they don't know who to go to.
Who's helping them?
No one really. They have a called the Blue Project for the government, and so they have a task force of FBI agents, but it doesn't do enough.
And why should people care about this? You know, there's so many other problems in the world like hunger and poverty. Why is this a major global health issue?
People should be aware of this because girls and boys are taken away from their family each year, every day, and it can happen to anybody. And what I found was that an average person would be sold for $90, and that's more. That's your phone costs more than that, and clothing costs more than that. And I don't think a human being should be $90.
What role does this industry play in the United States specifically?
It's the second biggest income in the United States behind drugs. They accumulate $32 billion each year from this.
So this isn't like in another country, this is in the United States?
Yes.
And why do you think this is happening here in a modern country where we're supposed to be perfect, you know, an ideal society?
There's not a lot of prevention for it. People aren't educated, which they should be, like in schools. People don't know about it. They don't know how they can be taken, and often they're put into positions that makes it easier for them to be taken without realizing it. So,
you know, when your mother told you to stay away from the car, that's the people that take you?
yeah.
This is a very tragic, sad topic that everyone should be aware of. But we also were informed that your school is on a very special mission with kids in Kenya. Can you tell us about that?
The Kids for Peace came to our classroom and talked to us about their mission to help Kenya. And they had a school, they just recently made a school in McKay, and their school has a nurse's room that doesn't have any supplies for the kids that need help, because throughout the day, kids, when they get sick, they just fall on the ground and all the other kids just walk over them. So they need a place to get help and get well rested.
Let's be aware that these kids, their school is like their second home. They have nowhere else to go.
Yeah.
So what is your school doing to help?
Our school is collecting boxes full of medical supplies to help store their nurse's room to help these kids.
So back to the project. What did you guys learn from it?
I learned that girls that I go to school with, girls like me, are at risk, that it is here and it's around me, and that it's not, you know, some far off place, that it's not someone else's problem, that it's my problem too. It's here, it's in my world, in my society.
How can we help?
We can be aware of the signs of victims. They'll often have hotel keys or be wearing limited clothing, or they'll come with expensive things suddenly.
They miss school on Mondays and Fridays, or fall asleep in class when they are there.
Okay, so thank you guys for coming today. Next, we'll have on the other girls talking about birth control and how that affects the world.
So stay tuned.
Flu season is here, so now is the time to consider getting a flu shot to help reduce your chances of catching this season's flu. According to the U.S. Department of Health and Human Services, the flu shot is the best protection against contracting the flu. The cost of a flu shot is often covered by your health plan. Check your benefits documents and with your health plan and schedule an appointment today by calling your physician or visiting your local pharmacy or convenience care clinic. Many employers also offer flu shot clinics in the workplace. For more information, visit flu.gov. This message is brought to you by United Healthcare and this station.
Hello, I'm Karime.
And I'm Ian, and we are from the Oceanside High School Health Careers Academy, and today we will be your hosts. We'll be interviewing these beautiful young ladies that are also from the Oceanside High School Health Careers Academy, and they will be telling us about the Health Academy and their global health project.
Hey, so can you guys introduce yourselves?
Hi, I'm Brianna.
Hi, I'm Lynette.
Hi, I'm Melissa.
Okay, so what is the Health Academy?
So the Health Academy is a 4-year program where we've shown an interest in the medical field, and we have the classes of choosing in between sports medicine, first responder, and nursing. So the Health Academy is basically a school within a school. We have this amazing opportunity to be a part of this program where we've gone on amazing field trips. We've gone on we've had many guest speakers come in where they've come and inspire us about medicine. It's basically showing us if we are ready to become a part of the medical field, and it's basically the first step. And we get college credit for being a part of the classes.
Do you recommend these to other students?
Yes, I do, because it gives you a little glance of what medicine would be like and if you would want to go into the medicine field. And us as teens, we don't know exactly what we would want to go into. So if you would take Health Academy, it's like an introduction, and I really recommend it. It's really fun and you learn a lot.
And why is it important for teens to have like kind of an insight of what they want to be?
Well, it's important so that they could know what they want to do, like in their future, like if they really want to stick to health and medical. And the Health Academy helps give them an insight, like an introduction to the medical field.
So why are you guys in the Health Academy?
I'm in the Health Academy because I've really had a passion for taking care of people and curing and protecting. Basically, I want to be the change, and I want to be a part of medicine and basically reassure everyone's health, as well as many global countries. And being a part of the Health Academy is amazing because I get to see different career options for myself, and I get to see where I could find myself in a couple years.
I joined the Health Academy because I had 2 older brothers who didn't, and I love helping people. I love making sure that they're okay. I love making a difference. So I would talk to them about it, and I told them, is Health Academy like something you would recommend? They're like, yes, like it helps people, and since you love helping, since you like helping people, you should totally do it. Like, you guys have guest speakers, you guys have bike riders that come from college and they ride from coast to coast. He's like, you should really give it a try. So I gave it a try and I like it.
I joined Health Academy because I'd always had an interest in being in the medical field as like a doctor or a nurse. So hearing that it like gave us an insight on it really intrigued me into joining.
So about those bike riders, can you go more into depth into that? What was that?
The bike riders, they are doctors who are about to graduate and they go from coast to coast, and they are in a mission to raising awareness and raising money to give those globally around the world assurance medical supply needs in places where there isn't any supplies, because we know in for example Africa, they keep using the same medical materials because they don't have enough. So the money they raise, they stay in certain chapels and where they can stay for free. So at the end of the day, the money they raise, they donate it, and to make a difference is basically their basic goal.
So they talk about global health issues. You have a project related to this at your Health Careers Academy, right? Can you tell us about your topic?
Our topic is about raising awareness, which is insurance health. We're talking about birth control and protection and educating the uneducated. And because we've seen and we all relate and have personal experiences, we are very passionate and want to speak out to the public and actually raise up awareness in our teens, and because some teens don't know what pregnancies can bring and like the outcome.
What's the purpose of this topic?
The purpose of this topic is to educate boys and girls of our age and beyond our age, because this topic is so personal and important, because here in Oceanside we have the highest teen pregnancy rate, even though we have two clinics right down the street from us, and then we have Planned Parenthood just a couple blocks away. And this is a huge issue because most of these young girls don't get to further their education and don't see the financial income problems that come with the pregnancy. And we want to educate the further women in our generation, because we feel like as if many girls could have so much more opportunities if we educated them about the responsibility that comes with sex, with contraceptions, about confidentiality within clinics. These are topics that every young woman should know about, protecting themselves and male, as in using condoms to prevent sexually transmitted diseases.
And what kind of problems or issues can a baby bring to, for example, a teenager?
So a teenager that's sexually active can have problems like, if they're not protected, they could have problems like STDs, where they can like contract them and spread them without even really knowing. And other problems could be like actually getting pregnant and being a teen parent and having to struggle with being in school and taking care of their child.
So why is this a problem?
This is a problem because most teens don't have the financial stability to take care of a child. It costs so much to take care of a child. These teens don't have the support, or they don't have the financial needs. So in order to prevent a baby from even occurring is to educate the uneducated, basically. And we're going to educate them by knowing about the confidentiality that comes within clinics, about knowing the financial cost that these clinics have to offer. Most teens don't know that these clinics offer all these contraceptions, condoms for free. They assume that it costs money, so they won't even go out to get them. So protecting yourself is a #1 responsibility, and they don't know about these things, and it should be a #1 priority to protect yourself and everyone else around you.
And like Brianna was saying, like, we statistics show that it takes $60,000 to actually raise a child. And us teens, where are we going to get that money? We're barely finishing high school, or sometimes they don't even have an education. They stop working, they go work in a fast food. Like, we're not going to raise that much money for a child. Then we lose support, which leads why people take abortion. Out of the 100%, 59% take abortion because of the fact they don't have support, they don't have the money, they don't have anything. This is why we're trying to educate the people that are not educated.
So outside of the United States, how is a global issue?
It's a global issue because a lot of places, like in Africa, do have contraception, but it's hard for them to reach because like they don't have a way to get there, like transportation and stuff, and it's just they don't really know about it, like they're not educated on it, so it's hard for them. And then the problem with them not knowing is the fact that they're spreading and getting contacted with diseases, and being educated on the birth control can help with preventing the diseases from growing.
Is there any way this topic touched a personal aspect of your life?
For me, personally, this topic touched and really affected me as to why I chose this topic on educating the uneducated. For me, I had a very close personal best friend become pregnant at a very young age, and I watched her struggle, and I watched her graduate high school, but with so many problems and issues. And this should have been prevented. She should have known about contraception. She should have known about the diseases that come with sex. She should have known about the clinics we have nearby. I feel like this is something everyone should know about the responsibility, and I feel like as myself, I know about it, and I want to help everyone become protected and protect everyone else around them.
My personal story was I just recently had a baby niece 2 months ago, And my brother and his girlfriend now, they live together. But back then when they were sexually active, she didn't know what birth control was. She didn't know what Plan B was. She didn't know anything. All she knew, the protection was a condom. And yes, like that's our basic need, but sometimes a boy doesn't even formally know how to use it. So they had a sexual contact once, and then she went to the hospital once because she had pain. Later on, we found out she had a baby, and it's a baby girl, and her side of the family doesn't support her with the baby. They kicked her out, like they didn't want to know anything. Like they're there, but the support's not there. And then on my brother's side, he had to stop school for a while and had to find another job to sustain the baby because he doesn't have the financial stability, so he's struggling right now, and which is why I'm passionate about this. I want to reach those who don't know. She's 20 years old. We expect like them elderly to know about contraception, but sometimes they don't, and that's why I'm trying to reach them.
Well, these are all very tragic stories, and this can happen to anyone, so that is why it is important to spread awareness. Thank you for being our guests.
We have tremendous employees here at Tri-City, working every day and doing everything they possibly can to improve care to make it safer in a very complex and difficult environment.
Being 6 years free of a central line infection is unheard of. We went to an international conference, and the feedback we got from nurses across the world was amazing. They all wanted to hear our process and hear how on earth did you do that.
Everyone is diligent. We've done a whole culture change, which is really key to our success here.
We do daily huddles, patient safety symposiums. We do a lot of education out to the staff to make them aware how they can help us make things safer by talking to us.
So I feel very fortunate and very lucky to work at an organization that not only supports a culture of safety, but actually looks at the nurses. It's not a choice for us. It's not an option. It's 100% what's best for the patient.
We're continuously educating staff about the importance of reporting near misses or close calls, and it's a much safer environment.
Hi, I'm Anna, and I'm also a part of the Health Academy program at Oceanside High. And I wrote this memoir today to get people aware of other health-related issues in the world. On a personal level, I would like people to get involved. I wrote this memoir in my pre-AP English class that also is connected with the Health Academy, and I would like to share it with you today. James Gideon Bell. My pillow was drenched in tears. I couldn't stop crying, but I didn't want to. I wanted the emotions to flow out of me and allow me to forget. Why do bad things happen to good people? I said to myself. On June 29th, my siblings were born. Besides the fact that they were 1 pound in the NICU and born at 24 weeks, I thought everything was fine. I didn't know what to expect. They were in the hands of highly skilled nurses. James, Matt, Charlie, and Miriam were in tiny boxes. Later, I found out they were called isolettes, with machines and monitors all around them. After a couple of days, the emotional roller coaster started to go down a steep slope. It was a dark and rainy day when I got the news. James has a brain bleed and it doesn't look like it's going to get better, my dad said. I tried but couldn't stop the emotions. Sadness and anger rushed to me in big waves. I couldn't believe this was happening to me and my family. We did nothing to deserve it. Doctors explained everything to me in fine details. We rate the extent of brain bleeds a 1 to 4, Grade 1 being the least amount of bleeding and damage. Most babies can survive with the grade 1. A grade 4 is the most amount of bleeding and damage. I started to understand, but I wanted to know why it related to James. James has hydrocephalus. This means that there is a buildup of spinal fluid, which is causing his brain to push onto the other side. It is a bilateral grade 4 interventricular hemorrhage. This means the extent of James's brain bleed is too severe for him to survive. I couldn't believe what I was hearing. There's nothing we can do for him because he is too little for brain surgery. We are so sorry. I felt like my whole world was crumbling down on me. I would go to the NICU every day and spend my time with him and the rest of them. Every day I would say bye to James, tell him how much I loved him and how much I would miss him, because I never knew what the next day would bring. The 4th of July, I went home that night to watch the fireworks. While watching, I felt a bomb go off in my heart. I knew something had happened. I rushed inside with tears rolling down my cheeks to find a text message from my mom that said, "It's time. There's nothing we can do for him except love him forever and cherish the time we had with him." James died that night in my mom's arms while my dad read him a bedtime story. James will always be in my heart while we are apart. James taught me a lot in those few days. He taught me to live life to the fullest because I never know what the next day will hold. Also, when I think it is a bad day, it could always be worse. Winnie the Pooh said, "If there ever comes a day we can't be together, hold me in your heart, I'll stay there forever." You can donate to the Neonatal Intensive Care Unit in honor of James Gideon Bell. Thank you.